Getting more people vaccinated with a very targeted approach is still at the forefront of discussion here at City Hall. Toronto's Medical Officer of Health, Dr. Eileen De Villa, going beyond the recent emphasis on geographic areas in the city. She now wants to make sure youth get their shots now in order to be safe once school starts in the fall.
Vaccines delivered in the next 2 weeks will be done in time to ensure 28 days passes between first and second dose, followed by the 2 important weeks to develop fulsome immunity. Torontonians have embraced vaccination so thoroughly all these weeks and months. I really hope that our young people will embrace this moment too.
Dr. De Villa is now also recommending that a couple of bylaws that were put in place by the city for COVID response be repealed. They include additional requirements for restaurants regarding capacity, and distancing requirements in parks and public spaces be removed as well. However, masking policies put in place for apartment buildings will remain. Meanwhile, the city has laid out its plan for recreational programs as part of the Step 3 reopening. Starting next week, indoor fitness centers, walking tracks, swimming pools, meeting spaces will all be open for self-directed activities. Camp TO programs and vaccine clinics in community centers will still be given priority.
I want to reassure people that city staff have worked closely with Toronto Public Health to make sure that these reopenings are implemented safely and with all necessary adjustments to program capacities and program descriptions in order to ensure that these programs and services are being delivered safely.
Now, City Council also meeting today, and with that, Councillor Josh Matlow spoke about a letter that's been circulated from more than 200 organizations demanding that enforced removal of homeless encampments in the city be stopped. That's referencing the matter of police getting involved in the Trinity Bellwoods Park a few weeks ago. The mayor continued to defend the city's action, saying that staff continues to try and help, but that a, quote, passionate and firm approach needs to be taken.